We have been hearing that a deal is close on a health care reform bill. Joining us this morning from Capitol Hill, Democratic Congressman from Maryland, Steny Hoyer, the House Majority Leader, along with our guest host, John Podesta, the Center for American Progress. Leader Hoyer, good to have you on the program.
Good morning. Good to be with you.
How much sleep did you get? How late were you up? And what does that tell us about what we might or might not hear today?
Well, I got to bed around 2 o'clock this morning.
Oh boy.
So it was a long night at the White House. I think we're getting very close. I would certainly hope that within the next 24, 48, 72 hours that we have a general agreement between the Senate and the House. Obviously, we're going to have to move forward and make sure that our scoring, we've indicated this bill is going to be paid for. We've indicated we want to bring the deficit down with this bill. We need to make sure that those representations are correct in terms of whatever agreements we make. But I think we're getting very close.
There were some hopes that we could hear something at the Democratic leadership's presser today at noon, maybe get it scored starting this weekend. Is that too aggressive?
Well, I think it's, I don't want to say it's too aggressive, but I don't want to say that's going to happen at noontime. I think it's sufficient to say that we're very close. We're working very hard. As you can tell, we've been working very long hours to try to get this done for the American people. And the President's been very engaged in our discussions. As you know, we've been at the White House now 3 out of the last 4 days. And my expectation is that we will be getting very close today. Now, whether it's at noontime or later, I don't want to speculate.
Steny, it's
Hi,
John Podesta. The House has passed financial regulatory reform. They passed health care earlier. They passed energy legislation. They passed pay-as-you-go legislation to get the deficit under control. How frustrated are your colleagues now that we keep getting hung up on the 60 votes in the Senate?
Well, you know, the Congressional Quarterly says this has been perhaps the most productive House session in a very long period of time, maybe in history. You point out a number of pieces of legislation that we passed, which we think the American public not only support, but they are very necessary for our country. And we're very frustrated by the fact that we've had more cloture votes in this past session than at any time in history. Frankly, the Republican minority seems to be focused on opposition for opposition's sake. There doesn't appear to be much cooperation in the Senate at all. And I think the House, rightfully, and I think the country is frustrated that very important pieces of legislation languish in the Senate, not because, and this is the key point, John, they don't have a majority support. For the most part, they do majority support. Over 50% of the Senate supporting that legislation. But because of their 60-vote rule, their filibusters, they have been unable to get some of that legislation to the floor. So we're frustrated. We'd like to see it at least considered, up or down. If the majority of the Senate don't support it, fine. That's our system. But if you've got a majority of the representatives of the American people in the United States Senate who support a proposition, whether it's health care, fiscal reform, energy security, whatever it might be, we ought to see that legislation on the floor and voted up or down by the majority.
You think they'll go along with the fiscal reform and the pay-go provisions that you've championed when the debt limit comes up?
Well, I certainly hope so. Senator Conrad and I and Senator Reid and Speaker Pelosi have been working very hard. Obviously, as you know, John, you and I have discussed this, going forward, we need to focus on fiscal balance in our country, fiscal discipline, bringing the deficit down. Because of the deep, deep economic crisis that this administration confronted, the last administration incurred great debt. We've incurred great debt. We need to put this country on a road to fiscal balance and responsibility, and that will be our focus. One of the ways of doing that is to adopt statutory pay-go. Another way that Senator Conrad and Congressman Gregg have proposed is a commission to make recommendations on bringing that deficit under control. I'm hopeful that we can adopt both of those processes in conjunction with making sure that America can pay its debts.
Well, finish health care so you can get some sleep.
You bet. I'm for that.
Yeah, we were amazed at the lack of leaks, no blackberries in the room, interesting times.
Well, we think it's very important to make sure that no members or frankly the public thinks something's going to happen that doesn't happen or think something's not going to happen that does happen, in the sense that you don't want to build in opposition before, in effect, you make a decision.
Well, wait a second. In some ways, that lack of transparency, it doesn't let people know what's going to be in that bill until it's all over and done with, and people on the outside don't have any way to weigh in and try and affect changes.
Well, let me say this. There's nothing that's being discussed that hasn't been discussed broadly for the last, frankly, 2-3 years. This piece of legislation was discussed very widely during the campaign. Every candidate said we needed health care reform. Over the last year, it's had more exposure online, in-town meetings, in all sorts of fora than any piece of legislation, frankly, in the 30 years that I've been here has had. So I think we've had great transparency, and I think now we're just getting down to the stages where everybody knows all the things that are being discussed, simply as to what can be agreed upon between the Senate and the House, because we have differences, as you know, in some areas.
Leader Hoyer, appreciate your time this morning.
Thank you.
All right, we'll see you later.
All right, coming up, assets at